Well, since the days of the pharaohs 5, 6, 7,000 years ago, there's been thousands of failed medical theories every century, thousands of failed scientific theories every century. And the 20th century and 21st century is no different. Let's talk about one of the biggest scientific and medical theories, genetics, which is supposed to control everything. Well, we know that's a failed theory. Certainly, genetics determine your hair color, your eye color, your skin color. It will determine whether you're a boy or a girl genetically. It will determine when your liver cells reproduce it, they're going to make liver cells. Heart cells make heart cells. Intestine cells make intestine cells, and so on. Genes drive the development of an embryo. Okay, but there's not a single disease that's transmitted genetically. I want you to contact your young DVD associate and get a hold of the book Epigenetics, The Death of the Genetic Theory of Disease Transmission. By the way, it's the #1 bestseller according to Amazon in the area of genetics and medicine in general. Epigenetics, The Death of the Genetic Theory of Disease Transmission. The book Dead Doctors Don't Lie, and the book Rare Earths Forbidden Cures. And this goes into the failed theories of genetics and autoimmune and many others. But let's just look at genetics right now. So epigenetics is actually replacing the concept of genetics. Medical doctors have the false belief that genes are unautonomous, and they're going to do what they're going to do regardless of what you do. Okay? But that's not true. You can have very good genes. Your grandmother could have lived to be 110, and you can still die of a heart attack at 28 because it has nothing to do with your grandmother's genes unless you're getting everything she got. For instance, if she got all 90 essential nutrients in optimal amounts, so that would be a reason for her to live to be 110, 112, 120, so to speak. But if you're eating well but not getting all 90 essential nutrients like your grandmother got, again, your genes cannot maximize their genetic potential for health and longevity and fending off disease and strength and speed and making good decisions. So what do? Well, what we have to do, and of course you have to appreciate, the medical system has failed us terribly. Now, I'm going to jump back a second here to December 1st, 2008, cover article, okay, Time magazine. It said, despite technological advances in medicine, Americans are less healthy than we used to be. Remember, this is Time magazine, okay, December 1st, 2008, and that our children will be worse off. Medical experts are saying that our children will be the first generation of American kids who do not live as long as their parents. I want you to think of Steve Jobs' parents burying him at age 56. Iwata, the CEO of Nintendo, his parents buried him at age 55. And then Joe Biden buried his son, Beau Biden, at the age of 46. Okay? What is going on here? Why are kids being born with MS and dying at 10 months of age of MS? It's a disease of middle-aged people. Why are kids having thrombotic stroke where they get a blood clot in the brain and drop over dead in their tricycle at age 2 years old and dying of a brain stroke? What's going on here? Well, it's not genetic. It's certainly not cholesterol. So it is epigenetic. So let's have a look at that. What does that mean? Well, when I was doing that big project with the Center for the Biology of Natural Systems with Marlon Perkins from the old Mutual Wild Kingdom show, and I did my 20,000 autopsies, 17,000 of change, for 454 species of animals and 3,000 humans. What I was finding was that genetics and pollution played no part in deaths from natural causes. It was all caused by nutritional deficiencies. And I was seeing birth defects of every kind that appear in humans in Arctic foxes and llamas and ducks and flamingos and monkeys and boa constrictors and crocodiles, hummingbirds. What's going on here? Why are they having genetic diseases of humans? Well, it turns out they weren't genetic diseases. They're just simple nutritional deficiencies during pregnancy, and the genes can't function. They can't do their part without these 16 minerals, 16 vitamins, 12 amino acids, 3 fatty acids. And again, I urge you to contact your longevity associate and get the book Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book Dead Doctors Don't Lie, and the book Rare Earths Forbidden Cures. And what I want you to do, when you are dealing with a couple who are dating seriously, they're getting engaged, they're getting married, don't give them $500 gift certificate. Don't give them towels with their initials monogrammed on them. Don't give them a linen set to start their household. I want you to give them the 90 essential nutrients. You get more and more people who are doing this. They're getting them on auto ship. They're going to give them the 90 essential nutrients for 90 days, 6 months, a year, whatever the parents and grandparents can afford, and because you want to have their babies during development, during the pregnancy get everything that's necessary for the genes to work at their maximum level to generate and develop a perfect baby. Every birth defect you can name, and 10 times that many you can't, are caused by nutritional deficiencies of the embryo, not genetics. So this is in our hands. If you don't want a baby with cerebral palsy, with cleft palate, with Down syndrome, there's one baby out of 700 in America born with Down syndrome. Cyclops, where babies born with one eye in the middle of their forehead. We have babies who are born with all kinds of sexual problems, gay behavior, lesbian behavior, transgenders, okay, asexual, like, the spinsters who lived to be 90 years old and never went on a date. These things are all preventable. Contact your Youngevity associate and get a hold of the books, Epigenetics, Dead Doctors Don't Lie, and Rare Earth Bin Cures. And let's save our kids. I can't believe that, and I can't stand it, that the experts are saying our kids will not live as long as us. Okay? Join me and let's save our kids. And we'll be back with Dead Doctors Don't Lie for these messages.
If you're the type of person who likes to volunteer and help others, this should interest you. What better way to help people than to help them overcome their health challenges? Youngevity has been helping people overcome their health challenges for years. Our approach to health is drastically different than medical doctors who mostly only treat symptoms. As a veterinarian, Dr. Joel Wallach discovered that many common disease states are actually preventable and reversible. Our mission at Youngevity is to educate Americans about their own health. If you like helping people, join us in our fight to save America. While you're helping people prevent and overcome health challenges, you will also be able to build a lucrative home-based business. So what are you waiting for? Come join us and help save America. If you've decided to join us, call your local Youngevity associate to find out how you can arm yourself with the knowledge that's needed to save America.
If you've been diagnosed with type 2 diabetes, prediabetes, or the metabolic syndrome, and you're tired of seeing your blood glucose levels rise and fall like a ship on the ocean, but you don't want to take those drugs the rest of your life, Youngevity has an alternative. A product called Sweeties has been developed just for you. Used as part of your regular diet, Sweeties helps maintain healthy blood sugar levels, a formulation specially designed to nutritionally assist your body with the regulation of your blood sugar level. Sweeties supports healthy glucose metabolism because it's fortified with aspartic acid, chromium, and vanadium, all to help you promote healthy blood sugar levels. If you want to get off those drugs and control your blood sugar metabolism naturally, try Youngevity's Sweeties product. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
If you're up several times every night to go to the bathroom, have frequent urination during the day, feel like you have to urinate but then have difficulty getting a stream going, have leaking, dribbling, or urgency to the point a restroom must always be nearby, you may have an enlarged prostate. According to the National Kidney Foundation, by age 60, more than half of all men have an enlarged prostate, or BPH. By age 85, that number is 90%. According to the American Urological Association. Ultimate ProstFX from Youngevity has been developed for nutritional support of the prostate gland. ProstFX promotes prostate health and supports healthy prostate function. Stop sprinting to the restroom and avoid those embarrassing moments with ProstFX from Youngevity. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate and don't forget to ask about home-based business opportunities.
Through his research as a veterinarian, Dr. Joel Wallach discovered that most health problems afflicting livestock can be prevented and even reversed. Many of these same health challenges also occur in humans. These too can be prevented and reversed. Doc's original formula, called the pig arthritis formula, alleviated all arthritis symptoms in animals. The same basic formula has been developed for humans, called the pig pack, which includes plant-derived minerals, a multiple vitamin complex, glucogel, and EFAs. Add to that Youngevity's OsteoFX Plus, a proprietary blend of liquid calcium, magnesium, and glucosamine. Now you have the Pig Pack Plus to make up the 90 essential nutrients Dr. Wallach has identified as necessary for sustained good health and longevity. If you'd like to learn more about nutritional supplementation, call your local longevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Okay, Doug, what pearls of wisdom do you have for us?
I thought we'd talk a bit about ADHD today, as I've got a Fox News story here headlined, "More than 1 in 10 U.S. kids have ADHD as diagnosis rates surge." Say more than 10% of kids have it, and particularly they've seen a rise in girls and minority groups, according to this new study. They say spikes in diagnosis among girls, Hispanics, and older kids result in as a result of better screening and monitoring. They say roughly 5.8 million children have ADHD between the ages of 5 and 17, and that's a jump from 2003 to 2011. They say the rates jumped 43% overall during that period. 8.4% of kids had ADHD in 2003, where we're now 12% in 2011. Say diagnosis among girls jumped 55% from 4.7 in 2003 to 7.3 in 2011. According to the lead author here, Sean Cleary, a public health researcher at George Washington University, says, quote, "The sharper increase among girls was a surprise primarily because ADHD is typically diagnosed among boys." It goes on to say one possible explanation of the increased trend among females is greater recognition of ADHD symptoms observed, such as withdrawn or internalization. They say traditionally they're overlooked because they're not typically considered to be a sign of the condition. And they say they analyzed data of 190,000 kids from U.S. surveys conducted in 2003, 2007, and 2011, and they found that this was all parents reporting that their kids had been diagnosed. And they say boys accounted for the majority of the cases, and diagnosis for them rose 40% during the study period, 16.5% by 2011. They say age also played a role in the rate gains, as 33% kids increase in ages 5 to 9, a 47% increase in ages 10 to 14, and a 52% surge in teens 15 to 17. They say white kids still made up the majority of the diagnosis, but they said the rates among blacks and Hispanic youth has risen. They say diagnosis among Hispanic children spiked 83% over the study period, and blacks' diagnosis rose 58%. They say previous research had raised concerns that children from certain minority groups had been underdiagnosed. I personally believe, Doc, that they just found an untapped market.
Well, I think you're right, Doug. And of course, there was an article out less than a year ago which showed that the pediatrician makes $2 million every 5 years when they diagnose ADD, ADHD, or autism in a child. And so there's an enormous incentive, as you say, to keep looking for markets where they can find more and more kids that have these problems. And of course, the diet and our lifestyle contribute to all this. Back when I was a kid, we had 4 generations living in the same household. I had great-grandmother, grandmother, mom, and me. I never went to a daycare, particularly daycares run by government agencies, right? I had eggs for breakfast and beets for breakfast and sweet potatoes for breakfast. I had cheese and milk and yogurt made on the farm. We had beef and we had vegetables grown in our garden. It was fertilized by wood ashes in the garden. And I lived pretty good. And we didn't have, I can't remember any kids that had these types of problems back when I was a kid. It didn't exist. Well, today, all these kids are eating cereal, quick food, instant this, instant that, bottled juices, so they get nothing but sugar and carbohydrates, no eggs, because mama's worried about cholesterol, and so they're getting no eggs. They're not getting any sweet potatoes for breakfast. They're certainly not getting any farm-fresh vegetables that are fertilized with wood ashes, and as a result, these kids are all deficient. Now, how many nutrients does your brain need? 90. And so we have several problems going on here. Enormous incentive to the pediatricians, $2 million per kid that gets ADD, ADHD, and autism. And back in 1980, the rate was one autistic kid in 250,000. Today it's 1 in 45. And so then, of course, the diet is all screwed up, and they don't get any vitamins and minerals. So I can't thank you enough for bringing this to the surface so we can share this with our listeners. God help us if we don't take care of these kids. We'll be back after these messages.
Let's head to Eugene, Oregon, and Dorisa, you're on with Dr. Wallach.
Dorisa, is that correct? Dorisa? Hello?
Going
Hello?
once, going twice. Let's head on to Texas, and Vincent, you're on with Dr. Wallach.
Hello, Vincent, you're on the air. Hello, Vincent. Is anybody home?
Well, let's head on to Belleville, Illinois, and Bob, you're on the air with Dr. Wallach.
Hello, Bob.
Hello, Dr. Wallach. How are you?
Okay, this is Bob, right?
Yes, sir.
Okay, good. How can we help you?
Okay, I've got two questions. One is for a friend of mine, one of my college teammates. We wrestled together in college, and he's a big, strong, two-time national champ, actually. And he's been diagnosed with syringomyelia. So it's a cyst, I suppose, in his spine, is my understanding.
Okay.
And I want to know if there's any
wait a minute.
supplementation.
Syringomyelitis, maybe?
Myelitis, yeah, or syrinx, S-Y-R-I-N.
Well, syringo, yeah, it has to do with the coverings of the nerves in the spinal cord. Is that correct? Hmm?
Yes.
Okay. And how much does this guy weigh? You said teammate. Was he in wrestling or boxing or what?
Wrestling.
Okay. Wrestling, okay.
He's
and
now about 240 pounds now.
He weighs 240 pounds. Okay, and what are his symptoms?
Well, on his right leg, if he doesn't stretch or really kind of move a lot, it starts to turn inward towards his midline of his body.
Okay.
And he really has a hard time walking. I mean, he has to walk very slow. He has a hard time squatting down. It's just very...
Now, does he have any history of arthritis or joint disease or anything like that, cartilage or ligament problems being a wrestler?
He hurt his knee one time, but it was in a match.
Yeah, but that was trauma, maybe. Yeah.
Right.
Okay, does
right.
he have
but
any other
nothing
issues?
where he...
Any diabetes, high blood pressure?
High blood pressure. Mm-hmm.
Mm-hmm. Okay. All right. Okay, Shar, this is a Shar thing. Here's a guy that has, he weighs 240 pounds. He has high blood pressure. He's got things going on with his lower back. Of course, this is affecting how he walks and so forth. And we're going to have to run one of those message moments here. But we'll be back, and Bob will give you a program for your buddy and your wrestling teammate after these messages. Okay, Doug, let's go right back to Illinois and Bob. Okay, Shar, are you there?
I'm here.
Okay. This Bob's friend, who's an old wrestling team partner, weighs 240 pounds. He has lower back problems, and it can be maybe spinal stenosis. It could certainly be direct problems of his membranes covering the spinal cord, or maybe even a loss of myelin, the insulation material in the lower spinal cord. And so it's showing up as a thing going on with his leg on the right side. What would you do for this guy?
Well, if it was me, I would get him on 2 healthy bone and joint packs, and I would add the Ultimate Daily, the Niacin Plus, and the Cardio Sticks.
Okay, excellent, excellent. And what if it's spinal stenosis? What would you add there?
Spinal stenosis?
Yeah, kind of like osteoporosis of the lower back.
Well,
You said the glucogel.
yeah.
Yeah.
Well,
What
the
else?
bone and joint pack's got the glucogel in it.
Right. But what would you do? What would you do for nerve transmission in case there's nerve transmission?
Oh,
You're
synaptive.
Yeah, there you go, girl. Okay, throw the synaptive in, and of course we also have in the healthy bone and joint packs. Bob, we've got the CM cream, which he can apply to his lower back, to his lumbar area, and oftentimes that will give relief down in the hips and the legs and the knees and so forth, because it's called a peripheral neuropathy. So let's go that direction. Okay, second question.
Okay, second question. I was on statin drugs for about 5.5 years, the avorstatin, and I went off of it in August. And I was losing my memory is what was happening. And I felt like I was in a fog. Ended up tearing my bicep just doing normal work, nothing extraordinary. And I want to know, is there a detox program to make sure I get that stuff out of my system? I feel like it's not completely gone, is what I'll say.
Okay, well, this is again a Shar thing. What would you do for Bob here, Shar?
Well, for that, what he needs to do is eat a lot of eggs and butter.
Okay, and what program would you give him?
I get him the brain and heart pack because he needs to rebuild the myelin in his brain, because that stuff does make you lose your mind.
Yep, very good, excellent, perfect. And would you also give him the synaptive?
Oh, yeah, absolutely.
Okay. And what would you do for a detox? What would you do to detox him? You know what I like to take every evening before bedtime. What would you give him?
You mean the HGH?
No, I'm talking about detox at bedtime to help get rid of drugs out of his body.
Well, isn't selenium supposed to do that?
Well, that'd be heavy metals. What about herbal rainforest?
Oh, okay, yeah.
Yeah, right. I'd go with the herbal rainforest, Bob. I'd go ahead and get you 1 quart. That'll last you 2 months in the beginning, because I want you to start out with a tablespoon at bedtime, which is half ounce, okay? And so that 1 quart will last you 2 months. And the interesting thing about herbal rainforest, it has 14 cleansing herbs. They all kind of do it different ways. There's 78 minerals in there, so it'll kind of, just in case there is some heavy metals or toxic metals or drugs or things like that in there that the doctors have been giving you, the 78 trace minerals will help you there in the major minerals. But also I like those 14 cleansing herbs. You will be amazed at how good you're going to feel. Okay, well, we'll be back after these messages.
Let's head to Washington State. And Sharon, you're on with Dr. Wallach.
Hello, Sharon. You're on the air.
Hi. I've heard you speak in Spokane and in Yakima, and I gather that I'm about 3 years older than you are.
Okay.
But I'm not near as sharp, I'll tell you that.
Well, I don't know.
Anyway,
You sound pretty sharp to me, so how can we help you today?
I'm wondering how much is old age and how much I can do something about. I seem to have increasing weakness in my right side, especially my arm and shoulder, and it's gotten to I can hardly even write my name. It just takes me about 3 times as long to do something.
Well, how much do you weigh? How much do you weigh?
About 125.
And let's see here. Do you have any other issues? Do you have any high blood pressure, diabetes, arthritis?
Arthritis, probably. I have a bad back. I've too many hay bales and feed sacks.
I gotcha. Okay. All right. Do you have children?
2,
Do they have any health issues?
My son has type 1 diabetes.
Okay.
There's no other diabetes in the family.
Okay, well, it's not genetic. Okay, type 1 diabetes is called an inborn error metabolism. When the islet cells, the beta cells in the islets were farming to make insulin, you were missing something, and so he didn't get as many made as needed for an adult to have enough insulin. So he's going to have to take insulin shots the rest of his life. But let's see here. Shar?
Yes.
Yeah, this lady here, Sharon, is about our age. You're 72, I'm 75, and Sharon says a little bit older than me, so I'll take her at 77. Is that correct?
I'm 79.
79, okay. So we're all kind of in the same age category. And so what would you do for her, Shar?
Well, it sounds to me like she's got arthritis and probably some plugged up arteries for the nerves, not being able to move. I would give her a healthy bone and joint pack, but then I would also add the Ultimate Daily, the Cardio Sticks, and the Niacin Plus.
Okay. And so Shar's correct. You go ahead and get yourself one of the healthy bone and joint packs. It wouldn't hurt also to get an extra bottle of the Osteo, so you can take 2 ounces a day, and be sure you're going to take 10 glucogel a day, 5 at breakfast, 5 at dinner. That one bottle that comes with the healthy bone and joint pack should do that. And then the Ultimate Daily tablets, go ahead and get 1 bottle a month. That would be, that would be 3 tablets twice a day. That's 1 bottle a month of the Ultimate Daily tablets. They're designed to support and promote healthy blood pressure and designed to support and promote healthy blood flows for obstructed arteries. And that one healthy bone and joint pack, you're also going to get the CM cream. What would you add to the CM cream, Shar, to have Sharon get major pain relief and also to get things moving?
I would add the trauma oil.
Trauma, okay, very good. Yeah, go ahead and get an extra bottle of trauma oil too. It's a little 10 ml, very kind of like a half a tablespoon of trauma oil. It's a blend of aromatherapy oils that actually relieve pain, relieve inflammation. Go ahead and put 4 to 6 drops of that trauma oil in a teaspoon of the CM cream, and then rub that on your neck and your upper back. You may have to have help from somebody to do that since you have a reduced range of motion in your shoulder. You can rub it on your shoulder, your neck, and that's going to give you pain relief. It's going to reduce inflammation. It's going to increase your range of motion and so forth. Then give us a call every couple of weeks if you want some extra energy. You can go ahead and use our Rebound. We have it in the non-carbonated form, either in the sticks, just tear them open, put them in a 16-ounce bottle of water, shake it up and drink it, or we have them in the canisters. You can take a couple of scoops and put it in a 16-ounce bottle of water and shake it up and drink it. Or if you like the canned drinks, comes in cans, but it has about 10% of the carbonation of a soft drink, so I wouldn't drink the canned version with the carbonation at meals. You can drink it between meals, or if you're going to drive all night, drink it to keep you awake. Okay, give us a call every couple of weeks, Sharon. We'd love to work with you. All right, Doug, we have time to start another one?
We sure do. Let's head to Florida. And Richard, you're on with Dr. Wallach.
Oh, Richard, you're on the air.
Hi, Dr. Wallach. I'll give you my my problems here.
Sure.
I have Crohn's disease. January, I went in the hospital, had surgery because of an obstruction. She took out 28 inches of intestines. I was on 3 weeks coma after that. And then the week after the coma that I got out of the coma, she put me on dialysis. So I've been on dialysis since February. I don't think I should be, but I'm still urinating a little bit.
Stop. So you have reduced urine volume, and do you know what your creatinine level is, your blood creatinine level?
Yeah, it was around 10.
Yeah, well, that's warrants dialysis. It should be below 1. It should be like 0.82 is where I'd like it to be, and so 10, yeah, you need some dialysis there, and get that volume of urine up and get the creatinine down, okay? And do you have diabetes?
No diabetes, no high blood pressure.
Okay, good. Okay, what do you weigh, sir?
175.
All right, okay. Shar, here's a guy, Crohn's disease. It's kind of a cousin to irritable bowel syndrome, IBS, that kind of stuff. Also, he has been put on dialysis because he has reduced kidney function. And so what would you do for this guy?
Well, first of all, he's got to get on a gluten-free diet.
Bingo, you hit that one, A+. Okay, go ahead.
That's what Crohn's disease is the end result, the worst scenario from a gluten intolerance.
Right.
And so I would get him on two healthy brain and heart packs, and then get him on the Ultimate Daily and the Cardio Sticks and the Niacin Plus to get the all the arteries opened up so he can urinate again.
Support healthy blood flow through obstructed arteries. And when you have a elevated creatinine, Richard, they put you on dialysis, in most cases there's nothing wrong with your kidney. In most cases you have an obstructed artery supply to the filtering units, and the dirty blood can't get into the filtering units. And, of course, this coma thing, this could have been due to blood clots that occur following surgery. That's pretty severe surgery, which removes 20-something inches of intestine. And Char's exactly right. This is Crohn's disease is due to a gluten intolerance. So you have to do everything correct. You got to get rid of all the bad stuff. Absolutely no fried foods, no processed meats with nitrates and nitrites. It means no deli slices, sandwich meat, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, Spam. All that's got to go. You got to get rid of all the oils. That means no microwave popcorn, no theater popcorn, no olive oil, coconut oil, margarines, mayonnaise, salad dressing, cooking oils, no gluten, no wheat, no barley, rye, and oats. Char's exactly right. I would have you take the 2 Healthy Brain and Heart packs per month, a full dose of everything twice a day, and add the Ultimate Daily Tablets, 3 of those twice a day. That's 1 bottle a month. The Ultimate Cardio Sticks, I'd go ahead and take 2 of those a day, 1 at breakfast, 1 at dinner. That's 2 boxes a month. And the Ultimate Niacin Plus, take 2 twice a day. That's 2 bottles a month. Get that circulation going through those kidneys. And then call us every couple of weeks and let us know your creatinine level every time they measure it, and we'll walk you through this. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 95 Crusade. And Doug, let's go to callers.
All right, let's head to Detroit, Michigan. And Anthony, you're on with Dr. Wallach.
Well, Anthony, you're on the air.
Hey, Dr. Wallach, God bless you. God bless you. I got a gentleman.
Thank you. How can we help you? You have a guy.
A gentleman that. What'd you say?
You have a guy, a gentleman, okay.
Yeah, that's a truck driver.
Okay.
And I told him about your experience, and he's on the line. He's 46 feet, 40 years old, 6 feet, 271 pounds, alopecia, Altera, and vitamin D deficient.
Okay, I missed the first one. Okay, I got vitamin D deficient. What's the first one?
Alopecia.
Yeah.
Eye problems, cloudy, when he has pressure, I guess. Sloppy stool and acid reflux. Mr. Nakia?
Okay, loose stool and reflux. You said he has cloudy eyes?
Yes.
Okay, now is this when somebody would look at you, they would see the clear part of your eye, the cornea, that would be cloudy, is that correct?
Sometimes, yes.
Both eyes, okay. So you've lost some vision there. Are you still driving?
Yeah, well, it's not lost. It's just sometimes I've had cataract surgery.
Mm-hmm. Okay. Did you have this problem with your corneas, this cloudiness on your corneas, before you had the surgery or after the surgery?
This was the reason I had the surgery.
Okay. Did they give you a corneal transplant or a lens transplant?
They get cataract surgery.
Okay. All right. Okay. Well, let's see here. 271 pounds, and you're 6 foot tall. I'd say you're 71 pounds overweight. So we've got to work on that. And do you have any high blood pressure or diabetes?
No.
Oh, okay, good. All right.
I've been diagnosed with sleep disorder also.
Okay, sleep problems?
Yes.
Okay. Okay, Char, what would you do for this guy? 70 pounds overweight. He has a vitamin D deficiency, and he's had cataract surgery. He's got reflux, loose stools. What did you get? And
he also said he had alopecia, which I think is a gluten intolerance, correct?
Well, yeah, alopecia, hair loss, can be gluten intolerance. He has a loose stool, gluten intolerance. Okay.
So he needs for the reflux, he needs the enzymes, the ultimate enzymes.
Okay, well, what would you give him? What would you give him in general here? He's got all these problems going on.
Well, he needs to get on a gluten-free diet, obviously. Yeah. That's the big problem.
What would be his basic supplement program for a 271-pound guy?
I'd get him on he needs, ultimately right now, he needs 3, and I would get him on with the eye problems and everything, I'd get him on the Healthy Brain and Heart Pack, 3 of them.
Okay, what would you give him? what would you give him for the vitamin D deficiency?
Vitamin D.
Well, there's a plan. Okay. Yeah, we have a wonderful little capsule of vitamin D. It's 5,000 international units per capsule. And I'd go ahead and take 4 of those a day, 2 at breakfast, 2 at dinner time. That's going to require 2 bottles a month of our vitamin D capsules. And for, as Shar said, your basic program, you need to have 3, ideally. If it's a financial problem, just go with 2. Don't go any less than 2. But ideally, you would go with 3 of the Healthy Brain and Heart Packs. It'd be a full dose of everything at breakfast, lunch, and dinner. And then for the reflux, the ultimate enzymes, as Shar said, I'd go ahead and take 2 or 3 of those, 5 minutes before each meal with a couple ounces of water. And if you have really belching, burping, bloating, and reflux kind of stuff, I'd go ahead and also get a couple of bottles a month of our peppermint oil from our aromatherapy division and put 4 to 6 drops of the peppermint oil in an 8-ounce cup of either warm water or hot peppermint tea and start sipping on that when you take your enzymes, you begin your meals before each meal. And for what would you do for his being over 70 pounds overweight? What would you give him?
I give him a SAP.
Okay, well, I'd go ahead and get 2 bottles. And again, if it's a financial problem, just go with 1. But ideally, you go with 2 bottles of the ASAP. Take a dropper full under your tongue 30 minutes before each meal, a second dropper full 15 minutes before each meal. If you can only afford 1, just do the 1 30 minutes before each meal. And you'll lose a half pound, 2 pounds a day. Call us every couple of weeks. Let us know how it's going for your friend, Anthony. Okay, well, great testimony today. Great question. Thank you so much, Shar. Super job as usual. Thank you, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
The antioxidants found in many fruits and vegetables are known to help support and promote good health. Research has also shown that dark chocolate, once known as the food of the gods, is rich in healthy nutrients. In fact, dark chocolate is higher in antioxidant content than any other food. Longevity has combined a proprietary blend of velvety rich dark chocolate with whole fruit pulp and whole fruit juice extracts from mangosteen, goji or wolfberry, acai berry, and cherry, along with vitamins and minerals, producing a smooth, rich, delectable concentrate called Congenital. It tastes so great, I sometimes drink it right out of the bottle or pour it over ice cream. Congenital is highly bioavailable, meaning your body will absorb and make use of all of these healthy nutrients. If you'd like to learn more about nutritional supplementation, call your local longevity associate and don't forget to ask about home-based business opportunities.
Numerous studies have shown the link between the intake of antioxidants and disease prevention. Foods and supplements are measured in an ORAC scale. ORAC is an acronym for Oxygen Radical Absorption Capacity. In other words, the ability to remove disease-causing free radicals from the human body. Longevity's Cell Shield RTQ has an ORAC value of 15,800 points per serving. Cell Shield RTQ contains resveratrol, known as an anti-aging compound, turmeric, known for promoting healthy digestion, brain function, immune system, and cellular longevity. Quercetin, a flavonoid, is known for promoting healthy blood sugar metabolism and healthy lung and cardiovascular function. Remove free radicals from your body with Cell Shield RTQ from Longevity. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. 3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Youngevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the ultimate tangy tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewables, and besides that, they're not as good as tangy tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.